The Spinova Immo Plus is a multifunctional orthosis for stabilization of the lumbar spine and the junction with the sacral bone. Its special construction permits controlled treatment according to an individually adaptable multi-stage regimen. The scope of delivery of the pre-assembled Spinova Immo Plus: base support with adjustable posterior connector inserted, shell, abdominal fastening with finger pockets, tensioning strap system with a buckle fastening, shell connectors, side clips, anatomically shaped abdominal pad, tools and accessories for assembly included in the package: 2.5 mm Allen key, Torx key TX40, 2 Velcro patches and 2 Velcro strips. The Spinova Immo Plus requires only the Velcro patches. Not included in the package: crimping tool, tape measure, sandpaper, shears, Torx torque wrench TX40, small screwdriver. First, take measurements in order to determine the size of the orthosis. Measure the abdominal circumference just below the navel. The orthosis is available in 6 sizes, for abdominal circumferences from 70 to 140 centimeters. Select the size accordingly. When dismantling the Spinova Immo Plus to adjust the adjustable posterior connector and shell, first attach the blue strap ends from the adjustable posterior connector. Unscrew the fastening of the adjustable posterior connector using the 2.5 mm Allen key. Turn the orthosis over and undo the buckle fastening. Unhook the gray tensioning straps from the side clips on both sides. Then unfasten the base support from the abdominal fastening. Put the abdominal pad to one side and disconnect the shell from the base support. Now remove the adjustable posterior connector from the base support. Shape the adjustable posterior connector by means of the integrated aluminum stays, using a crimping tool if required, to suit the patient and the indication. The upper edge of the device is the width of 2 fingers below the shoulder blades. Proceed as follows to shape the adjustable posterior connector to suit the patient's indication and the spine. Stabilization. The device fits completely on the lumbar spine. To reduce lordosis, a gap approximately the width of 1 finger is left between the adjustable posterior connector and the curve apex of the lumbar lordosis. To support the lumbar lordosis, the adjustable posterior connector sticks out slightly at both ends. push the shaped adjustable posterior connector back into the velour pocket. Palpate the iliac crest to ensure that the Spinova Immo Plus is correctly positioned. Instruct the patient to put on the shell loosely over a crease-free t-shirt or undershirt. The stamped arrows on the inside of the abdominal fastening should be pointing upward. Position the orthosis on the patient's torso so that the recesses in the pelvic frame sit above the iliac crests. After loosening the 3 screw connections, shift and bend the 2 halves of the shell system until they are as flat as possible against the patient's torso. Then tighten the 3 screw connections up again, the middle one by hand and the upper and lower ones using the 2.5 millimeter Allen key. Make sure that the halves of the shell are arranged as symmetrically as possible. The upper edge of the shell should be approximately the width of 2 fingers below the shoulder blades. To ensure that the shell is optimally adjusted to suit the body, please take note of the lines for cutting and wedges that have been provided. If necessary, trim the upper edge to the appropriate height, cutting along the marking. You can cut notches or completely cut out wedges on the lower edge of the shell. Then smooth the cut edges, for example, using sandpaper. To adjust the width of the shell, you can attach the shell connectors to another horizontal fixing. Place the open shell in front of you with the inside pointing downward. The arrow on the shell should be pointing upward. Use rivets to attach the 2 supplied Velcro patches to the outside of the shell, one in the top middle and one in the bottom middle, following the course of the spine. Place the base support on top and screw it with the integrated adjustable posterior connector into the middle screw connection of the shell. The opening of the velour pocket should be pointing upward. Turn the orthosis over and undo the Velcro fastening on the outside between the abdominal fastening and shell connector. Now reattach the base support on both sides. If required, the abdominal fastening can be adjusted to suit the patient's anatomical body shape by cutting the base support. To do this, take off the orthosis, then mark out a line for cutting. When cutting, make sure that you leave a sufficiently wide area for the Velcro fastening on the base support. Instruct the patient to put the Spinova Immo Plus back on. Hook the blue tensioning strap ends onto both sides of the adjustable posterior connector to suit the indication. The positioning of the tensioning strap supports the function of the adjustable posterior connector with regard to neutral stabilization, lordosis, and reducing lordosis. Now hook the gray strap ends onto the side clips on the abdominal fastening. The straps must not cross over one another. To avoid local pressure peaks in prominent parts of the body, the side clips can be set either horizontally or vertically. To adjust the tensioning strap system, the locking devices on the blue strap ends must be set to open. If this is not the case, use a screwdriver, for example, to move the sliding device to the open lock symbol. Instruct the patient to close the buckle fastening as follows. Take hold of the ends of the buckle fastening, pull them evenly and simultaneously to the side to begin with, and then forward. Hook the buckle fastening in a central position over the abdomen. Now set the locking device on the blue strap ends back to closed. Pull the strap system taut by tightening all 4 Torx screws on the blue strap ends evenly in a clockwise direction, little by little. Pull the system taut by no more than 1/4 to 1/2 turn per pass. Repeat the process until the desired degree of tension is achieved. We recommend you use a Torx torque wrench with a torque of 0.25 Newton meters. To check that the tensioning strap system has achieved the correct degree of tension, instruct the patient to undo the buckle fastening, pull the straps to the sides, and fasten it again. The patient should be able to hook the fastening back in the central position again. The orthosis is then adjusted correctly, and the patient can continue to use the Spinova Immo Plus to suit the indication even if the circumference measurement changes. Note down the position of the tensioning straps on the adjustable posterior connector in the patient's instructions for use. This will make it possible to reproduce the patient's individual settings later on if required. In future, the patient can put on and take off the Spinova Immo Plus properly himself. Slide the fingers from the side into the finger pockets provided on the abdominal fastening. Pull the 2 halves of the fastening slightly to the side. Fasten the right half onto the left and raise the abdomen slightly from underneath. Finally, pull the ends of the buckle fastening evenly and simultaneously to the side to begin with, then forward, and hook in a central position. For the best fit, we recommend practicing putting on the orthosis in front of a mirror. Spinova Immo Plus is a multifunctional orthosis that stabilizes and relieves the lumbar spine. The gradual removal of functional elements allows the orthosis to be flexibly adapted to suit the patient's level of mobility.